everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to our Q&A Mondays. This is the place where I answer your direct and specific questions as long as they are not diagnostic in nature. So if you do have questions for me, please go ahead and leave it below in the comment section. You can also email them directly to me at info@drzphd.com. My email is also in the bio. Having said that, I, as always, have selected 6 questions randomly. We will go through them together. I have not read them myself yet. There is also going to be timestamps below in case if you want to jump around and look at any specific questions. Also, as always, I have blocked out everybody's names to make sure that your privacy is being maintained. So let's get started. First question for today. My questions here are, what is your professional opinion on some of the non-binary options that are now becoming available at some clinics? Have you worked with patients who had any of the non-binary options, and have they gone for revisions for a more binary transition more often than not? This is a really good question. And it's a two-part question, so let's look at the first one. So the first part of the question is, what are my opinion about non-binary medical options? In my opinion, I think it's amazing that there's more, not only non-binary, more variable options in terms of hormones, but also there's variable surgical options for non-binary individuals, ranging from, you name it, from penectomy to individuals wanting completely a gender, I would say non-gender chest representation where everything gets removed, including nipples. I think that those options are important because I think there are individuals who don't fit all of the particularly binary options that do exist even for transgender individuals, because a lot of the surgical options are still quite binary, right? Because it's transmasculine, transfeminine, and that's still binary to masculine or feminine. So I think it's great. I think it's phenomenal. I think it's important. Have I seen anybody who identified as non-binary and they got a non-binary option, either surgical or medical, and then decided to go ahead and go through a more binary transition? And have I seen that more often than not? To be honest, it's hard for me to say, because the individuals I work with, once they complete whatever their goal is in working with me, they usually move on and live their lives. And unless they reach out to me and share where they're at in their lives, there's no really follow-up. So that would be impossible to say one. With individuals that I've been working with who did come back to me, even though we completed our goals, and they came back to me because they wanted to work on some additional aspects of their gender identity, what I have seen is not that individuals went back to more binary options, but is that individuals' gender identity has evolved and their understanding of the relationship to their gender has evolved beyond what they initially thought it was. And that may or may not lead to additional modifications. And a lot of times it really doesn't. But to say that, I would say that if I were to read this question phrased as if, would you say that non-binary people almost always then reverse to a more binary presentation? I can't answer that. In my opinion, from just interacting with a lot of non-binary people, interacting with a lot of non-binary subscribers, I would say the case that is not true. So I think non-binary is a standalone identity, and it can be a stepping stone for a binary identity for some people, but it's not always the case. Good question. And non-binary people who are watching this, chime in and share some of your opinion and your thoughts and your experiences. Question number 2. Dear Natalia, I thank you for all your work. Your channel is very precious for us, and I can only thank you from the bottom of my heart. You are all very, very welcome. It is absolutely my pleasure. I love the work that I do, truly do. I've been willing to ask your opinion for a while now. My only family is a sister whom I live with, and we're very close and talk about everything, including my journey of self-discovery, transition, and so on. In general terms, she's very supportive, but she says she doesn't see me as a woman. That is, she doesn't see feminine traits in me, whether physical or psychological traits. She fears my trans identity may come from some trauma or self-deceit because I gave no previous signs I might be trans until I was 34, 2 years ago. My transition is happening in slow steps, mainly laser hair removal, clothing, small changes in behavior, diet, etc. I've tried to give up, and that only made me miserable and dull. On the contrary, when I incorporate feminine elements in my life, I feel more confident, happier, I feel like myself. The conversations I have with my sister make me doubt myself, though. Am I really as feminist as I want to be? Am I deceiving myself? She also feels like she's losing the brother she had, no matter if I'm the same person deep down, and the prospect of making a person I love go through grieving and a sense of loss, especially considering the loss of our mother last year, makes me feel selfish, vain, and a horrible person. God, my heart so goes out to you. I would give up. I would give up if that didn't make me profoundly unhappy, but going through and hurting my loved ones is also a horrible prospect. Any advice you have for me would be immensely appreciated. Hmm. I want to give you a hug. And this, I think so many people can resonate with this. When I read this, what comes first to my mind is how hung up your sister is on femininity, feminine traits, feminine expression, feminine behaviors, feminine. It sounds almost like she's hung up on stereotypes. And you're starting to get a little bit hung up on that too, right? Because she's being hung up on it, and you're starting to question yourself as by proxy, by the proximity of her being hung up on it. Um, I think that trans, in this case, a trans woman, trans feminine identity, um, is so much more than feminine traits, is so much more than feminine behavior, so much more than feminine expression or feminine psychology. I mean, what are all of those things anyway? Seriously, if you think about what is a feminine psychology? We think of those things in terms of categories and groupings because we as humans categorize in groups of things because we constantly aim to control things around us. We constantly aim to define things. We constantly aim to give meaning to things because we feel that sitting in the unknown is paralyzing. Sitting in the unknown is very scary for a lot of us. So we have to all realize that we have created this restrictions um, that are now suffocating all of us, really, whether you're trans or cis or any gender expression or identity or otherwise. So I think it's important not to get hung up on all of the things. When two people are as close as you're close to your sister, it is inevitable that any potential, and I'm completely assuming, any potential hang up she have internally, subconsciously, even about what she says she's losing her brother, is going to be, it's inevitable that part of it is going to be projected onto you. And it could be projected in this a resistant type of form, in the form of, you know what it reminds me of? Sorry, I'm like having a stream of thought. It reminds me of this. When we suddenly change our life in a drastic way, right? People around us are suddenly pushing against the change because whatever we're doing with our change is holding up a mirror to whatever it is they need to change in their life, whether they realize it or not. And suddenly people are pushing against it. And suddenly people are telling you things such as, this is not you, this has never been you, it doesn't seem like you. This doesn't even have to do with gender. This just happens anywhere in life. Anybody who ever started their own business, there would have been people in their family or close ones who would push against that idea. Anybody who has suddenly decided to change their life. Let me use myself as an example. So in January, I changed my lifestyle and I started to do, I used to do cardio all the time. Now I'm doing very heavy lifting right now because I want to change my body composition. As I get older, I realize having body strength is essential to me. When I started in January, I have lost like 20 pounds very quickly just by being in calorie deficit, eating very healthy, and lifting heavy weights. My mom started to immediately resisting, pushing back on that, saying that you're big boned, you won't look good if you continue to lose weight, you look so good being voluptuous. There was so much pushing back. Um, Are you sure you're eating well? It wasn't until she came and she spent time with me and saw how much healthy foods I consume and what my healthy lifestyle really is that she was able to back off. But initially, people will have that resistance because it's the relationship that we have to anybody who's close to us, like you and your sister, creates its own ecosystem. People get accustomed to that ecosystem. They get accustomed to status quo. Suddenly you're changing. Suddenly she is forced by the nature of you changing to change herself, to change her orientation to you, to change her relationship slightly, right? In other terms, you're growing, and now she has to grow with you. And a lot of times we don't realize how resistant we are to grow with another person. And I wouldn't want you to outgrow your sister. And I wouldn't want your sister to outgrow you. I would open up conversation to talk to her more about this hangs up on this language, hangs up on what feminine really is. And I would also open up conversation to let her know how you feel so happier and so much joy when you are embodying yourself. And that when you do stop, like you did stop, you feel all of those negative things and how that is also telling you. And ask her, would you rather have a brother that is unhappy and miserable, or would you rather have a sister, even though it's going to be, maybe it sounds like it's challenging for you to adapt to who I'm evolving to be, but wouldn't you rather to have a happy sibling rather than the unhappy one? That's what I would really recommend for you. I don't think you're being selfish. I don't think you're being vain. And I don't think your sister is being selfish or being vain. I think both of you are trying to find a way to, um, like I said, your ecosystem used to be one way, and now it's shifted because you have changed in a drastic way. And now your sister also has to come forward and shift too. And you two are doing this dance and you're finding a way to do it without stepping on each other's toes. And that can be challenging and there can be tension. Um, and sounds like you two are very, very close. It sounds like you two will continue to be very close. And I would just have this conversation. Sometimes having this conversation and really sharing how you feel and how things make you feel are incredibly, incredibly instrumental. Um, yeah. Great question. What a beautiful relationship you have with your sister. I'm very close to my two sisters, very, very close. And I know what it's like when something changes, they resist too. So don't give up. And especially you're doing things slowly. You're giving yourself and her lots of time to adjust. Be kind to yourself, be kind to her, and have those open conversations with her, especially how things make you feel. But I don't think that you being selfish or you forcing her into anything. If it wasn't gender, you would have evolved, something else would have evolved in you. We're constantly evolving and changing. Um, that's the beauty of being human beings. So I wish you all the best. And thank you for such a great question. Question number 3. Hi, Dr. Z. Small font. And you all know how blind I am with my eyesight. Need to get progressives or bifocals. Either way, need magnifying glass by now. Hi, Dr. Z, loving your Q&A sessions. One for a future round Q&A. Thank you so much. I'm glad you're loving it. I've had dysphoria for over 20 years. Whew. But I'm so scared of making a mistake. I have done very little to try transition. Being assigned male at birth, for the most part, I'm comfortable with that. But I worry that a lot of my dysphoria is sexual and primarily due to the desire to have the opposite genitalia. Women come in all shapes and sizes and cannot be defined by their clothing, their careers, or their habits. 1,000%, you're right about that. Is there a difference, therefore, between gender identity and gender expression? What should people look for to differentiate between any effeminate or can personality and true gender dysphoria? This is a great question. First of all, for you, let me break it down a little bit. So you have experienced gender dysphoria for 20 years. That's a long time experiencing gender dysphoria. You describe your gender dysphoria as sexual dysphoria, meaning you are uncomfortable with your genitals, but comfortable with everything else. And that can be very challenging because that for a lot of people does leads to a confusion. What does it have to do with my gender identity? And it's a lot of times, not a lot of times, gender dysphoria doesn't necessarily have to be stemming from gender identity. It also could be stemming from, um, in this case, sexual dysphoria. But I'd be curious to know, could it be possible that it's actually body dysmorphia for you? That's something perhaps for you to explore with a local therapist in your area. You're right, women do come in a completely different representations, expressions, roles, behaviors, emotions, you name it. Is there a difference between gender identity and gender expression? Yes. I have a great video that is titled Gender Identity versus Gender Role versus Gender Expression, where I do a great job breaking all those things down, because there is absolutely a difference. Gender identity is your core sense of who you are in relationship to your gender. Gender expression is how you like to show up and express yourself to the world, and also express yourself within the world. So it's your expression. And your expression in regards to gender doesn't have to be in alignment with your gender identity. It can be, but it doesn't have to be. This is why we have, for example, women who express themselves in a masculine way. When we have transmasculine, gender-identified people who express themselves in a feminine way. And you name it, the combinations are numerous. What should people look for to differentiate between, say, an effeminate, or I don't know what a camp personality is, I'm sorry, and true gender dysphoria, you put in quotation marks. So I think we all have our own subjective definitions, internal definition of what effeminate is. So that is purely subjective, and also based not only on inner subjectivity, but also based on your context, your relationship, your life, as well as the constructs of your time. True gender dysphoria, so let me think how when I answer this, because first thing that comes to mind is there's no such thing as true gender dysphoria. As where we exist right now in the world, we have what I guess I would call clinical diagnostic gender dysphoria, that is gender dysphoria based on DSM, Diagnostic and Statistical Manual. If you meet required criteria, then you have a clinical gender dysphoria. Then, of course, there are all sorts of gender dysphoria. Clinical doesn't necessarily imply true gender dysphoria. In my experience, I'm less interested in true or clinical gender dysphoria. I'm more interested in how it manifests in your life, one. Two, to what extent it's actually stemming from gender identity incongruency. And if that is the case, then my follow-up question is, how severe or mild it is. In other words, how much is it affecting your lifestyle, and what you think and feel about it, and what do you, if anything, want to do about it. So that's how I would throw it out there, and hopefully that helps answer your question. Thank you for the question. Good question. Question number 4. Dear Dr. Z, thanks for all the work you do to help our community. My pleasure. I have a question. If has already been asked, I'm sorry for that. I also wrote too long to feel free to use any parts. Oh, too long. So you wrote long. No, this is okay. Use any parts that will be helpful to other, and live out whatever you need in order to fit it into the time allotted. I'm a lesbian trans woman, and I have been transitioning for over a year. I have been on hormones for about 7 months. I feel so much happier as a person, and I have developed so much more self-worth than I ever had before. I had basically zero before. Oh, that's really great to hear. I'm really glad that it's working out for you very well. I have been married to my wife and loyal to her for over 23 years. We have a child who is non-binary. I love my family more than anything. My early transition was very rocky and negative, with my wife being very unsupportive and me being stupid. However, for the past 6 months or so, she has been very supportive. My child has always been extremely supportive of my identity. We all love each other so much. That's beautiful. I have had recurring thoughts of cutting off my genitals for a very long time, all the way back to childhood. I'm so sorry to hear that. I would wish I could cut them off and have them grow back female. I would talk as a child also without knowing what that meant. I had severe childhood trauma come along about the time. I was just figuring that I was trans girl and my life was completely destroyed. Now, since starting to transition, I have been having frequent intrusive thoughts of cutting off my genitals. Like open the drawer to get out a knife to prepare for food and then uh, thoughts rushing into my head. I'm also daily cry in the shower and hate using the restroom because I have to see and touch them. Yeah. I have to wear a gaff in the shower and to bed just to survive. I feel I need to have a vaginoplasty. My wife made me agree early on that I wouldn't get a vaginoplasty or she would leave me. Mm. She's homophobic and transphobic to some degree. She thinks she will be forced to be a lesbian if I have gender confirmation surgery. We told her that's really not true, but since then, my bottom dysphoria seems to only get worse and worse. I feel I can't live without my family and I can't live without vaginoplasty. She refuses to go to couples therapy also. My question is this: does what I described sound like extreme gender dysphoria? Is there any way around not getting a surgery I know I need? How can I get her to understand I can't live like this forever? This is oh, this is a very tough question, and I can hear the pain and I can hear the agony as you describe your painful and incredibly dysphoric relationship to your genitals. In my experience, anybody that is entertaining thoughts of hurting their genitals, just that entertaining thought of that in of itself, to me, is an indication of severe genital dysphoria. I think anybody watching can, whoever experienced that, can agree with that. Um, I yeah. So, is this a severe gender dysphoria? Yes, it is. It's a severe genital dysphoria in your case. Now, is there a way of not getting a surgery? This is a tough one because you based on what you shared, you are also very invested in your marriage. You're very invested in your relationship. You're very invested in your family. It's really, obviously, it's very clear. It's really important to you. I'm not one of the providers who says when it comes to deciding to go through surgical gender transition, you have to think about yourself only and not give a shit about anybody else. You can, it's your prerogative. When a person tells me that the preservation of the family is really, really important to them, then it's really, really important to them. And I have to work within the confines of that importance, in my opinion. I understand your wife is not supportive. I understand, like you said, she is homophobic and transphobic. But what matters to me from what you shared is that you, regardless of how she's, you still want to preserve what you have going on, and that's makes things much more challenging. And for any kind of compromise or any kind of discussion to even have a possibility of happening, she has to be able to at least be open to a dialogue about it. I get a lot of rigidity from what you shared about her, that it's just absolutely a no, almost an ultimatum, right? And the ultimatum informs that if you're going to do this, I'm going to leave you. I'm also hearing on your end that if you don't do this, it sounds like there might be potential self-harm. In these cases, what I recommend for individuals who are struggling with this situation is to really try to open a dialogue. I know she doesn't want to go to couples therapy, but something has to happen, right? So some discussion needs to take hold, some discussion needs to open up, at least open a dialogue to try to get her to understand to what extent is the dysphoria severe for you and how you're having this thoughts about hurting yourself. It is always helpful when we open up feeling passageways and when we actually tell people how certain things make us feel. That opens up for empathy and compassion for another person. But it is really, really tough. in this situation, it's almost impossible to have both, right? It's impossible to fully preserve what's going on and also have surgeries that is most likely will help you alleviate quite a bit of genital dysphoria that you feel. So it's almost impossible to have two, right? Because something going to have to give from her side too, in order to foster this, in order to make this all happen, in order to preserve what both of you so much work toward for. It's a tough one, and this is really, really where couples therapy really becomes essential for therapists to help break through the resistances and find some kind of form of compromise or discussion. But it's a tough one, and I don't know what to tell you. People, respond, come to different decisions. Sometimes people finally realize that. Even though they want to preserve family unit, they realize that they can't, and so they just move on and decide to go with surgery, and as a result, dissolve family unit, and they have to live with the decision, and they just at some point realize that decision to better their health becomes important. Some people, they decide that staying in a family unit is more important to them than bettering their health. That is your for you to decide. That is something that nobody can ever decide for you. Of course, I always side where I want you to be dysphoria free as much as possible, because I know the pain that it causes, and I don't want anybody to suffer at all, ever. But a tough one. Try to open a conversation. Try to see if she will be engaged in any kind of therapy at all. And hopefully things will move a little bit more from there. And I really, really wish you well. Really, my heart really goes out to you. Question number 5. Hello, Natalia. I always listen to your show and find your content particularly helpful. Thank you so much. I have been on estrogen now at a low dose for 2 years. This is to cope with gender dysphoria and is extremely successful. I still live as male and hide my femme side from everyone for fear of ridicule in my community. However, do dress as female when away. I now could never pass as female, sadly, and this would be my ultimate wish. I have so much inner turmoil surrounding gender and sexuality. I find to be transitioning and becoming more feminine, I'm much less desirable to women generally than my male self. At times, I have stopped hormones to revert back to masculine, which makes me sad, yet necessary to be attractive to women. Really, I'm proudly trans lesbian, but the dating possibilities there seem to amount to zero. I guess there's no easy answer with this dilemma. Do you have any suggestions that would help going forward? So this sounds similar to the question we had on Q&A not too long back, when a person also identified as transgender, trans woman, and were sexually attracted to women, but the dating pool of women who were attracted to women were like non-existent in their geographic area, and they were debating whether they should detransition or whatnot. Here's the thing, though. I hold the view, and this is just my view, that if you're transgender and you're struggling with dysphoria and it's bothering you, and transition sounds like, at least what you've been doing, is really helpful, then that's helpful. When people tell me that they stop taking hormones and stop presenting in their authentic gender because that makes it more likely for them to be able to find a relationship, an intimate relationship, my question to them always is, well, what happens to dysphoria, right? The dysphoria doesn't just suddenly disappear. And are you just bargaining with yourself and really toying with this idea, trying to get yourself more time? And that would be my question to you. Are you bargaining with yourself in order to get yourself more time? Let's say you do get in a relationship with a woman, and already knowing that you're struggling with gender dysphoria, down the line, how is it going to affect the relationship? What is going to happen to the relationship? How is it going to affect you? So if I were you, I would ask all of those questions and sit with them. If you're not in therapy, is it possible for you to see a gender therapist or just a therapist in your local area, and to explore all of those things as well? But you all know me. I would not advise, like, oh, disregard your authentic gender. in order to, because it's so much easier to attract people with your gender assigned at birth, and all the while being deeply uncomfortable with your gender assigned at birth, it just doesn't, it's not feasible. And people who know, I know so many people who've done this, and in the end, they just struggled even more. So just think about it. I think there's room for you to explore the things and dive a little bit deeper. And final question for the day, question number 6. Hello, I'm definitely trans masculine. I kind of want tea and almost everything that comes with it, but I studied musical theater in college, and my singing voice is one of the few things I have never hated about myself. I'm afraid of how my family would react if I went on tea, but I'm mostly afraid of potentially ruining my singing voice. Do you have experience with assigned female birth singers going on tea? Do they tend to keep the quality of their singing voice, just lowering their range? Thanks. What a great question. So I do have very limited experience with this, and the quality and range of the voice does change. And because this is what I did when I saw this question, when I was pulling the questions, I saw this question, I reached out to Erin, who is a vocal therapist, licensed vocal therapist that works with a lot of my clients. And I asked her this question: how does tea affect assigned female at birth voice if they are singers? So I'm going to give you an answer from a voice therapist, and hopefully that is going to really help you. And anybody else who is wondering how testosterone changes your vocal range, if you are musically inclined or if you're singers. This is what Erin had to say. Testosterone adds mass to the vocal folds, decreasing the pitch and increasing a heavier and darker sound for both singing and speaking, usually about an octave. So there's the answer. Hopefully that is going to be a good answer for you to satisfy you. If you have more questions about this, feel free to just email me and I can ask Erin more, and I can also ask Jordan, another wonderful voice therapist that works with a lot of my clients. So that is it for today's Q&A. Thank you so much, everybody, for all your wonderful questions. And thank you, everybody, for being vulnerable and sharing so much transparency and so much vulnerability about your lives so openly with everybody else, and allowing not only me to answer the questions, but by answering all of your questions, allowing other people to find things that resonate to and are able to get clarity on their own situations. If you have questions, please don't hesitate to email them to me or to leave them below. Leave comments. I love reading all of your comments, and I will talk to you all next time. Bye.